Hello and welcome to the Middle-Aged Encyclopedia. Prostate cancer is a dangerous disease that is becoming more common among men in their 40s and 50s. According to the American Cancer Society, 60% of prostate cancer diagnoses in 2019 were in those over the age of 65. The prostate is located behind the bladder and is regulated by the male hormone testosterone, which creates sperm. It can happen to any man, but it is more likely to happen to those who are older, have a family history of it, or are obese. Consuming high-fat or high-sugar diets may raise your risk of prostate cancer. If that's the case, we'll go through some prostate-friendly foods in this video. And I will tell you in the last video about the foods bad for prostate. Make sure to watch all the way to the end of this video. Subscriptions and likes enable me to create better videos. First, broccoli. Broccoli includes various dietary components that aid in the prevention of some malignancies. There is a research looking at the link between cruciferous veggies like broccoli and prostate cancer. Researchers aren't sure why this has a positive effect on prostate cancer, but they say the sulforaphane content in cruciferous vegetables like broccoli kills cancer cells while keeping them healthy. Second, sesame. Zinc is abundant in sesame seeds. To maintain a healthy prostate, minerals are essential. Zinc levels in the bodies of men with an enlarged prostate or prostate cancer are much lower, often as much as 75% lower, compared to those with healthy prostates. It's easier to absorb zinc from food sources than from supplements. Consuming meals with sesame will help your health. Almonds, red beans, and pumpkin seeds also have high concentrations of the zinc. Third, tomato. High levels of the antioxidant lycopene in tomatoes suggest they may be useful in preventing prostate cancer and slowing the growth of tumors in patients. Tomato eaters have been shown to have a decreased chance of developing prostate cancer. Lycopene, which is found in tomatoes, helps stop cancer cell development and avoids harm to healthy cells. The health benefits of lycopene are enhanced by cooking tomatoes since the compound is more concentrated and easier to absorb. However, vitamin C is lost after prolonged cooking. Whether it's raw or cooked, it's important to consider what nutrients you're lacking in your diet. Fourth, pomegranate juice. Antioxidants abound in pomegranate. It has been shown to be effective in warding against chronic illnesses brought on by oxidative stress. Researchers have shown that the antioxidants in pomegranates help destroy prostate cancer cells and prevent the disease from spreading. Prostate cancer patients having either surgical or radiological intervention were the subjects of a research. Prostate-specific antigen, a marker for screening and tracking the progression of prostate cancer, was shown to either lower or speed up its rise in response to pomegranate juice use. Fifth, fish, omega-3. The danger of developing prostate cancer is reduced, cholesterol is lowered, and brain activity is stimulated thanks to omega-3 fatty acids. It lowers systemic inflammation, which in turn lowers the risk of chronic inflammation-related diseases including prostate cancer. But if you're taking it as a supplement, be sure to stick to the prescribed dosage. Too much of it has been linked to an increase in prostate cancer. The blood of supplement users was compared to that of non-users in a study conducted by the American Cancer Society. Higher levels of omega-3 were associated with an increased incidence of prostate cancer by 40% and of malignant prostate cancer by 70%. When eating more nutritious foods, it's easy to lose track of how much you're eating. If you have prostate cancer or early symptoms of the disease, you should talk to a doctor before deciding whether or not to take a high-dose supplement. 6. Green tea. It is one of the most widely drunk teas in the world, with a history stretching back thousands of years. Consumed as a tea for centuries throughout Asia, it has been linked to the continent's comparatively low cancer rates. Among the compounds in green tea, catechins, flavonoids and xanthine derivatives may lower the risk of prostate cancer. Men who consume 5 or more cups of green tea daily have a lower risk of developing prostate cancer than men who do not. 7th, cherry. Parallel alcohol, which is found in cherries, has been shown to kill cancer cells. Cherries contain quercetin, ellagic acid, melatonin and anthocyanin, which prevent and help prevent prostate cancer. 8th, legumes and soybeans. Soybeans, peanuts, and lentils are all examples of legumes, a class of plant foods. Phytoestrogens are plant chemicals found in legumes that have biological activity. To give just one example, isoflavones are a type of phytoestrogen. One study indicated that the chance of developing prostate cancer was reduced by 20% in those with the highest intake of phytoestrogens compared to those with the lowest. Phytoestrogens may be able to prevent cancer because of their impact on hormone balance and cell death, as well as their antioxidant qualities. More research is needed to establish a firm correlation between soy isoflavones and a decreased risk of prostate cancer, but some studies have found such a connection to be present. The levels of prostate-specific antigen in men who regularly consume soy are lower, according to research conducted by the National Cancer Institute, NCI, PSA. The prostate secretes a protein known as PSA. The PSA test is a blood test used to detect prostate cancer at an early stage. Soybeans appeared to be more effective when combined with other cancer-fighting nutrients, according to the study. 9. Strawberry. Berries such as strawberries, blueberries, raspberries, and blackberries are rich in antioxidants that can neutralize harmful free radicals in the body. As unwanted byproducts of normal biological processes, free radicals pose a long-term health risk if allowed to accumulate. Consumption of these foods has been linked to a decreased risk of prostate cancer. Eating these foods regularly can aid in both preventing and treating prostate cancer. However, it is advised that you speak with a physician before deciding whether or not to take them if you are receiving treatment or taking related medicines, as drug interactions may develop. Let's take a look at some prostate-harming foods now. First, dairy product. A higher risk of developing an enlarged prostate is observed in men who consume dairy products on a regular basis, BPH. Butter, cheese, and milk may make BPH symptoms worse, so cutting back or eliminating them could be helpful. Second, salt. Symptoms of BPH related to the urinary tract may be exacerbated by a high salt diet. Some guys may benefit from eating less salt and fewer processed foods. Third, non-organic chicken. Hormones, antibiotics, and steroids are routinely injected into chickens in factory farms, which has a negative impact on both the chicken's growth and the quality of the meat. Toxins are created during digestion because the bird's tissues expand to 200 to 300% of their usual size after eating, a situation for which the digestive system was not designed. Heterocyclic amines found in chickens have been associated with DNA damage in cultured human prostate tissue. So far, we have learned about foods that are good for the prostate and foods that are not. Leave a comment below to let us know if and how much this video has helped you. I'm waiting for you in the next video. Subscribe to our channel for more informative videos like this one. Thanks for watching the video.